The Louisiana State Health Department confirms the season's first flu-related death of a child. So experts say of the roughly 20 states considered to have high flu activity, Louisiana and South Carolina top those charts. Ashland Brothers reports on the dramatic case and the increase.
Eleanor Whitman's family says you don't know just how good feels until after you've been bedridden.
It was just awful. I actually thought I was dying.
Some of them recently had strep, others possibly COVID or RSV.
It was just kind of like a circle in our house because someone would get better and then someone else would kind of get a different sickness each week.
Whitman just recovered from a bad bout of the flu.
It just felt worse than previous years.
On Friday, the state health department announced Louisiana's first pediatric flu-related death this season in Baton Rouge, adding that there were 3 pediatric RSV deaths in 2023. Dr. Fred Lopez with LSU Health says a rise in all respiratory illnesses is common this time of year, with flu season typically starting in October, peaking around January, and lasting through May.
This is a hotbed right now for flu, but don't forget about COVID-19 and don't forget about RSV and some other cold viruses that are out there.
State epidemiologist Teresa Sokol says this is the highest level of flu activity Louisiana has seen in more than a decade. And with that, hospitalizations are rising.
Activity in the U.S. this year, and really it's pretty much the same usually from year to year, starts to increase in the southeastern and the South Atlantic states first.
The state reported 165 new flu admissions this week and 149 the week prior. She says those most impacted being toddlers and elementary-aged children. Sokol says reports across all age groups indicate between 11 and 12% of emergency department visits are related to flu-like illness. Narrowing the focus, flu-like illness accounts for 31% of visits for children ages 2 to 4 and 36% for kids 5 to 11. They expect the trend to continue through the holidays as people travel and groups gather.
Not doing very well in promoting these vaccines. What they're really good at when it comes to COVID-19, RSV, and flu is preventing complications, taking it from wild to mild.
The influenza viruses that are circulating in Louisiana most commonly is H1N1, followed by the influenza B Victoria lineage, and both of these are included in this year's vaccine.
They say be mindful of young people, elderly, pregnant women, the immunocompromised, and those with illnesses who are at a higher risk for suffering from complications. And health experts say, of course, wash your hands, stay home if you're sick, cover coughs, and consider wearing a mask inside. There are antiviral medications available for flu and COVID. And as for vaccines, it takes about 2 weeks for immunity to kick in. Lauren, back.